And thank you, both ministers, for being here. Minister Holland, in your mind, is having made solely for mental illness a foregone conclusion at some point? Is that the destination we're going to get to?
It's my belief for folks who have an irreversible, irremediable mental illness from which they've sought all treatment and have been able to get no relief in many cases for decades, that eventually, when the system is ready, that people in that irremediable circumstance should have access to MAID.
Thank you for that. How do you propose to get systems ready with the two outstanding issues of suicidality and irremediability?
Well, so suicidality is an issue that's completely separate and apart. If somebody who has having suicidal thoughts, goes in and sees a clinical professional and seeks assistance, that's somebody who is able to be helped. Somebody who has a mental illness is somebody who, despite going and getting help for potentially decades, is unable to lift themselves out of that circumstance and is in an irremediable state that is in a state of decline, and so there's an important distinction to be made.
Thanks for that, Minister. You know, you talked about suicidality being an incidental thing, but realistically, it's part of the diagnosis of many mental illnesses. Is that not true?
Well, I don't, as somebody who suffered greatly and spoken publicly about my own mental health challenges, I do not believe that suicidality is at all incidental. What I'm trying to do is make a distinction between the folks that we're talking about in Bill C-62 and folks who are having a mental health crisis.
That was not the question I asked you. What I asked you specifically is suicidal ideation is an important part of a diagnosis of many mental illnesses. That's correct, is it not?
Yeah.
Simple question.
Yes, if you are mentally ill,
thank you very much.
Then that
so
could
how do you
absolutely
expect,
be present.
then, Minister, to get systems ready when suicidal ideation is a part of the illness that you're talking about? That doesn't make any sense.
Well, but what we're talking about is somebody not who has a mental health crisis and has suicidal ideation in a moment. We're talking about somebody who potentially for decades, and this is why we need to take time so that we can make sure that we are talking about the same cases. I'm sure
respectfully,
if I
Minister,
would posit
but when
to
you read the diagnosis...
well, let me just posit so that we're talking about the same thing.
I'm asking the questions, not you. Thank you.
Go ahead, Dr.
When you
Ellis.
look at the diagnostic and statistical manuals, 5th edition, which talks about mental illness, suicidal ideation is an essential part of the diagnosis of, for instance, depression.
Well, so what I would say is, you being somebody who with a history within the medical profession, if you have somebody who has tried absolutely everything and has been suffering a mental illness for decades, at what point, at 1 decade, 2 decades, 3 decades, how long before that person has autonomy over their own decision? And would you not recognize the difference of somebody who's suffering for many decades
Minister,
and trying to get service versus somebody who's in a mental health crisis?
I'm talking about suicidality, which you said was something that came on suddenly, or I forget what your exact words were, but clearly that's not the case. The second part of it is irremediability. And what we know clearly with irremediability with respect to mental illness is that it's impossible to prove. There's many cases, you perhaps being one of them, who have gotten better from mental illness. And here we are today talking about irremediability. And we know that those two things, suicidality and irremediability, in no way are related to systems.
Well, irremediable means that you aren't able to remedy it. So it means that it doesn't get better. You don't get out of it. It means that somebody is trapped in an illness that doesn't allow them. And I think it frankly gets back to the point where physical suffering and mental suffering, and when there's an illness, which is a very different thing than having a mental health crisis. A mental health crisis is something you can get out of. Mental illness,
Minister,
where it's irremediable, means it can't be remediated.
Not mine. Is diabetes irremediable?
Well, I mean,
simple question.
Is diabetes? No. Diabetes is manageable as a disease.
Mental illness is not manageable. Is that what you're saying?
There are certain mental illnesses that you would acknowledge and you've talked to doctors. I've talked to doctors. There's certain mental illnesses that people have not been able to escape.
Just as there's cancer.
Point of order, Mr. Chair. Point of order.
Point of order from Sidhu.
Mr. Chair, I just want to say the last panel we said rules should be followed and without interruption, please.
Look, it's fine, Mr. Chair. I would say that, could I just make this point very briefly? Cancer is irremediable. It ends in death, and it is irremediable. I mean, trying to make an equivalency between multiple different illnesses is I don't understand the point.
Last time, Sean.
Okay, Mr. Holland, you have, go ahead, Dr. Ellis. You've got another minute and 20 seconds.
Thank you, Chair. If I might remind you, Minister, I'm the one asking the questions, and if I have a question for you, as per the part of this committee, you need to answer it. The second part that we need to get to clearly is that this particular program that you have has a lack of safeguards. Substance use disorders, a mental illness, post-traumatic stress disorder, which your government has offered to veterans as a mental illness, as is autism. How are you going to square your circle with respect to irremediability with those illnesses?
Well, I think, first of all, I guess we just have different purposes in discourse. You know, I ask questions for seeking clarity and to get on the same page. We're trying to deal with a very difficult issue. When you're asking me the question about irremediability, I'm trying to say that if somebody has an irremediable condition, and we're talking here about not some other disease, we're talking about mental illness, somebody who's trapped in it. And I would ask you the question. I mean, and you say you don't want me to ask questions. My purpose of my question isn't a political point. It's one of clarity. If somebody is in a situation for 20 years, 30 years, 40 years, at what point, when they themselves are the ones asking for relief and are saying that they are in an irremediable condition?
Irremediability, though, you continue to say you need to get systems ready. Irremediability is something that you can't prove. You can't make a system to prove irremediability. It's an impossibility. That's a clinical judgment by a clinician in front of that patient. It doesn't matter what you change the system to, you're never going to get to the point of irremediability. We've heard from multiple experts that they are the ones that making that decision around irremediability, not a system.
Well, what I'm saying is that, and that's why I posed the question, because I think it's important for clarity. If you have somebody who is trapped in mental health that is saying that they want to end their life, and they say that for 5 years, 10 years, 15 years, 20 years, and they've attempted all therapy, they've attempted everything in their disposal, at what point do you feel that they have autonomy over that decision? If the answer is never, well, then that's an ideological position. And I can't really have, I mean, there's not a lot further to go. But if the point is that somebody at a certain point of suffering has an opportunity to have autonomy over their own life, then, you know, that's an important debate and one that is not rooted in ideology.
Thanks. Mr. Cooper, please, for 5 minutes.
Thank you, Mr. Chair. Minister Holland, you have repeatedly claimed this evening that the only persons who would be captured by this expansion of MAID for mental illness are persons who have been suffering with an irremediable, irreversible mental health condition for a prolonged period, decades, and have sought all treatment options. That is false, and you know it to be false. Minister, on what basis can you peddle such a false claim?
So I would hope that anybody who's in a mental health crisis would come forward and would seek mental health services. And of course, under the regime that we're contemplating here today, that would mean that somebody would get help. They would not have access to the regime. And what I'm saying, sir, is that the people that I'm speaking to, these are very real cases with individuals who are trapped in mental
Minister, it's my time and my question.
Go ahead, Mr. Cooper.
Again,
go ahead, Mr.
There
Use
are
it as you
no
will.
legislative safeguards, none whatsoever in the case of MAID for mental illness. All that would be required is for someone to have the sign-off of 2 clinicians, not even a psychiatrist, not even a medical doctor necessarily, and they would then have the green light and would be eligible within 90 days. So what are you talking about when you talk about safeguards? Because there aren't any.
Well, it's just not true. And Minister Varani can speak to it as well. That the intention. I mean, first of all, let's reverse this. I mean, the accusation in the way that you're coming at me is if somehow I don't care about people and their mental health.
You made a very specific claim repeatedly.
You're being extremely aggressive with me and not allowing me an opportunity to express. So I understand you have a political point to make. It's a question of whether or not you want to hear my answer.
It's not a political point. It's about truth.
Go ahead. Mr. Cooper, you're holding him a little too tight on the timeline. Take another 10, 12 seconds on this question. We'll move to the next. Go Okay, go ahead.
The safeguards are: you must be informed of available and appropriate means to relieve your suffering, including counseling services, mental health, disability support services, community services, palliative care. Person and practitioners must
it's my time. I'm reclaiming my time. I'm reclaiming my time. If you're referring to, and I'll go back to Minister Holland. I'll go back to Minister Holland. If what is being referenced are the so-called model practice standard, that has no teeth. That is very different from a criminal code safeguard. And with respect to that so-called model practice standard, there's nothing there that provides guidance on the lengths, numbers, and types of treatments, nothing that all treatment options be exhausted by the patient. So in the face of that, how can you possibly claim that this will impact only a small number of people who've suffered over a prolonged period of time? That's simply false, and you know it, Minister.
Well, you can say that. It doesn't make it true. And secondly, you won't allow us to enumerate the ways in which there are safeguards. So you say there aren't safeguards, and then you aggressively talk over me as we try to talk about what those safeguards are. I would simply posit to you that the eligibility criteria is extraordinarily strict, that the model practice standards being incorporated by the provincial regulators will be similarly strict, that the criminal code, if somebody violates those, is a criminal violation. It is not a light matter, and that my interest has been expressed.
My time, and I would cite,
and you're certainly making it clear what your time is about, sir.
Here's a fact. There was a survey released from the Ontario Psychiatric Association that provides that 78% of Ontario psychiatrists, this was released 2 weeks ago, are of the view that the current so-called safeguards are insufficient and will result in the inappropriate applications of made for persons who are struggling with mental illness. In other words, wrongful deaths. Why would Canadians believe you and trust you over 78% of Ontario psychiatrists?
First of all, my interest, like yours, is to protect life and to make sure that people who are suffering get every opportunity to get the help that they need. Two, that the situation that exists right now is asking for additional time, because we do believe safeguards are present, and I've just talked about some of those, but we think we have to go that much further to make sure those safeguards are there, so that people that are trapped, and by the way, we're talking about people in their own volition in an irremediable mental illness circumstance.
Minister, there are no legislative safeguards.
Well, you can say that.
Well, you haven't cited
theater.
one. You haven't
continue
cited
to play.
any.
Yes.
You haven't cited any, and you haven't responded to the fact that 78% of Ontario psychiatrists believe that whatever so-called safeguards that will be in place are completely insufficient. We're talking about wrongful deaths when there's an inappropriate application of mate. That's what we're talking about.
So we're talking here in this legislation
is what you've demonstrated is that
we're taking
ideological.
First of all, I'm just going to say I reject.
You're playing with people's lives.
I reject that totally. I reject
that. It's absolutely disgraceful.
No, what is disgraceful is mischaracterizing my position or mischaracterizing the position of any member of Parliament, sir. Saying that any member of Parliament doesn't care about any human life is a disgraceful thing that I will not tolerate.
Well,
and for you to step into this committee and make an accusation of any member of Parliament that they do not care about the life of another human being is absolutely beyond reproach, sir. I have spent my entire life, as you have, fighting for the good in this world. And for you to accuse a good person of not caring about human life, shame on you. Shame on you.
Mr. Chair, if I could just point out that the safeguards that I mentioned are in the Criminal Code of Canada. That is a legislated